Dan, something that I've always been interested in and bothered me in my training to some degree, and I'm much older than you, as you know, but anyway, it is that we tended to treat people the same, almost as if they came out of a cookie cutter. And this is what you have, this is what you need, and you have to do this, and make sure you do this, because if you don't, you're not going to get better. Are we still doing that?
Yeah, so we're just a few years different, so it's not that
really
much, but you do have more experience. It's still, in medical school, as doctors, we're taught certain specific details of illness, how to treat illness, first how to diagnose it, what tests to do, and how to treat it. And you're right, we learn how to treat illnesses, we don't learn how to treat a human being. Okay. And very few courses in medical school teach the students and then young doctors how to treat human beings. So we get to, I mean, it's part of medicine. We're so overwhelmed with the science and the technology and all the labs that we have to check, the details, that we forget that every person is different.
Right.
So because every human being is different in every aspect, from their genetic background, their chemical and hormonal composition, their beliefs, their cultural background, their nutrition, the way they live, the places they live, their energy, and from every aspect, people are different. So because they're different, we need to personalize treatment and personalize the approach. So those are the words that we're reading more and more about: customized treatment, individualized, personalized, or tailored medical approaches.
How much does culture play?
It's huge. So when we see as physicians, we see any person who has an illness, in this case cancer, because we're at the cancer center, we have to look at all these things. And first, how do we approach the person? What words do we use? I mean, you're the master in this, but we're sharing here the importance of communication. So a successful doctor will be able to help the patient when they're able to connect. So outstanding doctors can be the best physicians in medicine and science, but they may not be able to get the person, the patient, to follow the recommendations because there isn't rapport, there isn't communication. So when we talk about the tailor-made treatments, if it's the standard doses of chemotherapy, bone marrow transplantation, metronomic chemotherapy, we make the decision and recommendations to each person depending on what they need. Right. And what they need medically, what they need physically, and in their beliefs. And culture is huge, because if some people don't believe in medicine, don't believe in chemotherapy, they're going to have a hard time accepting it. For others who don't believe that nutrition is important, then it'll be hard for them to understand the importance of nutrition.
So what, do you have any telltale clues that tell you when the patient's not getting it, they're uncomfortable, or even confused?
Yeah.
What telltale signs? Did they say something? Is it in their body language? How do you pick up all this stuff?
It's a combination of things, and I think that's one of the things that you and I and many other doctors are interested in. How can we connect with patients and have that rapport where we perceive when they're understanding what we're saying, when they're accepting what we're saying, and when they trust what is being offered and what is being recommended.
Well, medicine is there is so much technology as far as the chemistry, the chemo, the radiation, etc. and the skills of surgery, but, and it's hard to bring up, but where does your intuition, or where does intuition come in here, or does it?
It does come in.
Okay.
I mean, the healthcare professionals, if it's the nurses, the doctors, the allied health professionals, we need to have the knowledge and the experience, but also a huge opening to connect and perceive what the person needs, but also there's that part of intuition that our experience is huge and is a very important factor, but then that inner voice, that intuition that tells us what does this person need, that's a huge factor too. Yeah. And physicians and healthcare professionals need to listen to that intuition, as patients do too. They listen to the intuition, their own intuition, what is best for them.